It's okay to take people off medicine if their diet is doing the work of the medicine for you.
Hey guys, thank you so much for watching our videos. If you'd like to support us some more, you can explore our homemade natural skincare products at purelytallow.com. Thank you so much for supporting my small business. Hey everybody, welcome to the Carnivore Revolution. I'm Serena, and my guest today is Dr. Tony Hampton. He's a medical doctor, a family medicine specialist in Chicago with 28 years experience in the medical field. Dr. Tony Hampton, thank you so much for joining me today.
Thank you. You sure it's 28 years? That's a long time, but yes, it's been 28 years and I can't believe it. And that's why it's good to have a little gray hair to prove that that's real.
That's right. The gray hair makes you experienced and makes people believe that you have the knowledge that you tell them that you have.
That's right. Absolutely. And I'm going to keep, my wife loves this. So it's really in her honor that I wear the goatee today.
That's awesome. That's awesome. Okay, so let's start with your unconventional approaches here, because so many doctors, conventional doctors, regular doctors, my doctor, almost everybody's doctors are telling them to basically follow the food pyramid, or I guess we use I don't even know, we use the My Plate thing now, I guess. I don't follow any of that. I know 5 a day the colorway, 7 a day the colorway. Most doctors are still giving that advice. And so I wanted to ask you how you came to believe that that's not the good advice. Like what made you change from your normal conventional medicine ways?
It's actually a challenge even now because I still study as a family doctor to maintain my certification. So when you look at the recommendations and you're trying to answer questions, you have to answer questions the way they want you to answer the question, not the way you've learned to practice. So for me, it really came down to recognizing that my patients were not exactly getting off medicines. They weren't really healing. And I never really questioned that. I just thought that these so-called chronic medical conditions are what you're supposed to experience when you have chronic medical conditions. You're just supposed to have it for life. You're supposed to take medicines. But then when my wife acquired the type 1 diabetes diagnosis, I went down this exploration. And when I first started, we had been vegetarians for a long time. And then I started looking at the studies. My intent was to write a book about how to use the vegetarian diet to manage diabetes. But when I did my research, I kept coming across when comparing low fat to low carb, it was always the low carb diet that would win when it comes to weight loss and diabetes. And it just didn't make sense. So I think when that occurred, I said, well, let's try this experiment with my wife. And when I did the experiment, we found that in order to control her blood sugars, it really just came down to carbs. So that kind of put me in this low carb space. We kind of went in that direction as a family. And for me personally, I was also suffering from irritable bowel. So I said to myself, okay, let's see if that gets better. It got better with probiotics and it got better with low carb. But then I started seeing influencers and I said, you know what? Let's try keto. Let's go even lower. And then I got it really courageous and tried carnivore. And not until I got to carnivore that my irritable bowel essentially disappeared. Now, don't get me wrong. If I go back and start eating those foods again, it'll come back like Brussels sprouts. But I just found that for me, that was the best diet. My wife's more of a ketovore. And what she finds is that in order for her to achieve a really good A1C, not have a lot of glycemic variability with the sugars going up and down, she doesn't need a lot of insulin when she's reducing the carbs. So the difference between a 4-carb meal for her and a 40-carb meal is night and day. So we'll do things like Maria Emmerich's lasagna, for
Mhm.
example, and we'll literally just replace the pasta, the lasagna, with something like deli sliced chicken, and you reduce
Mhm.
it from 40 to 4, and now she doesn't need as much insulin, and it's
Mhm.
much easier for her. So that's kind of we did an experiment. I advise everybody do an experiment, and if you don't trust anything doctor's saying, you don't trust what Serena's saying, your meter will tell you, right? So if your meter says don't eat that, don't eat that. And that's kind of where I ended. So the guidelines tell you to eat, it's okay to eat, 45 carbs per meal. It's okay to eat a little bit of this, eat from the rainbow. But even an apple, which is 25 carbs, that's from the rainbow. But does it really make sense to give a person with diabetes an apple if it's
Right.
like essentially the equivalent of 6 teaspoons of sugar. So it's kind of
Right.
common sense, but I think people need to do the experiment so they can actually see and believe what we're saying. So it's been a game changer. It's changed how I practice medicine. You know, I literally took a couple of people off medicines for their blood pressure a couple of days ago in one day. And I was never doing that prior to advising people to reduce the thing that causes the most problems, which is excessive carbs.
I ran into a friend at Walmart about 6 months ago, her and her husband. They both needed to lose, some weight. Neither one of them were healthy like they wanted to be, and their son also. And we talked for a while. And of course, I glanced in their cart while we were talking, and they had, not good foods in their cart. And about 10 minutes after I left the store, she sent me a message with a picture of their grocery cart. So they put everything back and replaced it with meat. She had taken metformin for more than 30 years. Never once did her doctor tell her, if you would just stop eating the processed foods or the sugar or whatever, the carbohydrates, you wouldn't need this. Why is that? Why don't the
It's
doctors tell people?
they're trained. If you look at the algorithms that tell us what to do, rather it's the Association of Clinical Endocrinology or any other algorithm, it will say start with lifestyle changes. But in practice, what really happens is that you'll immediately skip that part and go to the medication part of the algorithm. And the problem with that is that it doesn't really address why your blood sugar is high in the first place. So it's really about the training. The training is if you manage that blood sugar really well with medications, which I consider the antidote, temporary
Mhm.
cure, then you're being a really good clinician. So they're really following what they're expected to do, not recognizing that people with type 2 diabetes can absolutely reverse it if they don't eat the foods that raise their blood sugar, therefore requiring more insulin. So the doctors are well intended, but they may have never seen a person get off of their medicines before. They may have never seen a person get off their insulin before. So in their experience, their life experiences have never given them that other way of looking at things. And unfortunately, that then leads to them believing that if the patients are not doing well, it's because they're not compliant, or they're being recommended dietary patterns that don't really actually help them get off medicine. So if you follow dietary patterns that don't really help you get off of the medicine because you're actually encouraging people to eat carbs, then they're never going to get off medicine. So I think it's just the education. And so we have to be careful if we tell the world that doctors need to learn about nutrition. The question is, what are you going to teach them, right? So if you teach
Mhm.
them things that don't make sense, and that you haven't seen the studies that show that keto is the most effective diet for this reversal of type 2 diabetes. In fact, the American Heart Association, again, when they put out a position statement in the last year that recommended for the first time low carb and keto, they made an asterisk in that statement that said, oh, by the way, if you're doing keto, be careful because that dietary pattern will put you at risk of reducing the sugars too fast. And it's logical why that happens because you reduce the part of the diet that actually led to the rise in the blood sugar. So you need a doctor who's trained to de-prescribe medicines. And I assure you that that's something that we talk about, particularly for geriatrics, right? Because we want our seniors to take less medicine. But in practice, most doctors are not accustomed to seeing a patient with a normal blood pressure or a A1C that's 5.6 or lower. And intuitively, they don't even think to take the person off metformin. But they
Mhm.
invariably what they do is say, you stay on the metformin, stay on the statin, and keep doing what you're doing. Yet I've done all of this great work to reduce my need for medicine, and yet they had no clue that they should be telling the patient, you may not need that medicine anymore. So now you don't have to deal with the cost, you don't have to deal with the side effects and all the things that come from taking medicine. And again, we have to retrain our docs. First of all, yes, these low carb, keto, and carnivore diets work. And number two, it's okay to take people off medicine if their diet is doing the work of the medicine for you. So I think it's a retraining, and part of the work we're doing and why I appreciate you having a channel is that we have to, hopefully a doctor or advanced practice clinician hears this message and they can say, you know what, let me try this experiment and see if this works for my patients.
Yeah, absolutely. I think that's the key, is we have to have more doctors like you taking this stand and saying, but this is what works for this issue. They don't always have to take medication for the rest of their lives.
Yeah,
And then there's the main issue is the government, right? It's that these are the rules you have to follow,
that's right.
as far as giving out nutrition information, the pyramid, because that includes hospitals, nursing homes, the military, schools. So people who think, well, this doesn't affect me, it affects you on every level, because starting in some cases in preschool, in
That's right.
pre-K, your kids are being fed according to that food pyramid or my plate. And so it starts young. It
That's
starts
right.
really, really young. That same friend of mine was just in the hospital being checked out for what they thought was maybe a gallstone, probably from oxalate dumping is kind of what I'm thinking for that. But she was just in the hospital. And even though she told them she was on a low carb diet, they literally brought her, orange juice, apple slices, French toast, and
Yeah.
one piece of sausage.
But that's a low carb diet in the current health system. If you go to any hospital, you will get bagels on a diabetes diet. You will get applesauce. You will get fruit. You will get apple juice and orange juice. And it's so illogical. And it's just the way the nutrition professionals who help to put these diets together were trained. It's all about balance, eat from the rainbow. And if you have balance, it'll be okay. Very few people who go into the hospital eating that way who were not on insulin won't end up on insulin when they're in the hospital. So I have tons of patients who go into the hospital on metformin, and while they're in the hospital, they had to take insulin because we gave them the foods that actually raise their blood sugar. So it should be obvious that a bacon, sausage, and egg breakfast would have been better for them, but they would dare give them bacon or
Right.
the yolk of an egg because that's got saturated
Mhm.
fat. So I just think that people have to listen to their body, trust their meters, and doctors, for all the doctors out there and all the advanced practice clinicians out there, there's a little bit more wiggle room for us. Unlike with nutrition professionals, the guidelines are considered guidance. Therefore, we have a little bit more liberty to give recommendations that deviate a little bit because it's guidance, it's not the rule. Particularly when you say the American Diabetes Association now endorses low carb, particularly since we can now say the Association of Clinical Endocrinology endorses low carb. And I mentioned earlier the American Heart Association. So for those who are trying to stay in a conventional mindset, you now have permission. This is all within the last few years to actually recommend a diet that actually works, and you can do it without fear. And I think that's really important to put out there because most people are not aware. And for hypertension, we just did the DASH diet versus keto study that came out in June of 2023. And the DASH diet was literally half as effective as the keto diet for blood pressure and weight loss, and 3 times less effective for diabetes than the keto diet. So now we have a study, randomized controlled trial that says this is the better dietary pattern. But if I take a board exam test today and they ask me that question, I have to still put the DASH diet because that's the world. So it takes like years before the actions that we take catch up with the science.
Yeah, somebody told me recently it's something like 20 years before it starts to catch up. So with the US Dietary Guidelines, I did hear recently that they have put out a statement that the US Dietary Guidelines are for people who are metabolically healthy, people who are healthy, who are not overweight, people who don't have high blood pressure, people who don't have high cholesterol, blah, 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 blah. And honestly, doctor, you know what I'm gonna say? There aren't
No,
very many people like that, right? I mean,
no.
so what's a child to do in school? What are you to do in a hospital or if you're in the military? Because so many people are unhealthy while following or eating from those US dietary guidelines. And so if those are just for healthy people, what do you do in a situation where, like, let's say your child is in school and they are not metabolically healthy, but the school is serving a lunch that follows the guidelines and therefore it's just for metabolically healthy people? What are you to do? Just pack their lunch?
Well, yes. I think you're going to have to pack their lunch because when you think about the idea that is for metabolically healthy people, which is actually false on its face as well.
Mhm.
But when Tufts University came out with the most recent analysis, they found that only 7% of the folk in the United States are metabolically healthy. And I think that's really important to hear, because even if the guidelines made sense, it's not really going to serve but 7% of the population. And the people who are then forced to follow that, like our kids in school, like you said, military, nursing home, etc., those people typically are not metabolically healthy, and they're being forced to follow the guidelines in spite of that. So I just think that that's a problem. And I also think it's important to understand, what is it that metabolic health is. But before I comment on that, I want to say this. Yes, you have to bring your food to work. Yes, you have to bring your food to school. And sometimes you need to have metabolically healthy food, like a couple of boiled eggs in your purse, a couple of pieces of bacon in a plastic bag in your purse, so that if you go see a doctor like myself and your appointment was at 11 and you're not leaving out of there till 1, what do? Do you run to the local fast food, or do you have something with you to be, kind of prepare you? So you have to plan, and do a good job. But I just want to briefly just speak to this idea of metabolic health, because I call myself the metabolic health doc. I think it's so important that we socialize the term metabolic health for a couple of reasons. One is because, is carnivore and keto the only way to be metabolically healthy? No. I mean, you can do a Mediterranean diet and other diets and do it, but your goal is to achieve certain goals. The first is that you need to shrink your belly. So if your belly size is beyond what it should be, being a male or female, I think that's really important. And almost everything that we're looking at for metabolic health has to do with too much insulin, right? So if I have too much insulin, the insulin is going to have, its job is to get these GLUT4 receptors to allow glucose to come in. So if I have too many of those GLUT4 receptors letting more and more glucose in, I'm likely to get fat. And then you think about the second thing with good metabolic health is having a normal blood pressure. And when you have too much insulin in your body, that's gonna lead to constriction of your arteries, inflammation in your arteries, and also too much salt being absorbed via your kidneys. And that's what happens when you have too much insulin. Insulin is going to lead to blood pressure problems. So we got another reason why insulin's an issue. And then you have these triglycerides. We measure triglycerides and HDL. Triglycerides are like the fats that are floating around, and people on a high carb diet tend to have more. And when those triglycerides are high in your blood, that can increase your risk for cardiovascular disease. And you don't want to have a low level of HDL. And when you have triglycerides, it'll actually take up the HDL, and that can then lead to the HDL can then be a marker of heart disease as well if it's too low. And lastly, you want to think about the so we have the waist, the blood pressure, and the blood sugar, of course, is what I was missing. So if you have a high carb diet, your blood sugar is going to be high, and it's going to raise your insulin. So most of all of these problems are insulin related. And so if we can reduce the insulin, then we can increase our risk for not having, or reduce our risk for not having these issues. And now you can understand why I prefer keto over Mediterranean. I'm okay with quinoa and grains, but reality is those things are high in carbs. And for a person with diabetes, those types of grains can increase the risk for your blood sugar being high. Same thing for the DASH diet. They are okay with grains. Therefore, you shouldn't be surprised, looking at that DASH to keto study, shouldn't be surprised that the DASH diet didn't beat keto, because they're asking you to eat all these grains. And let's not talk about the fruit they're asking you to eat. So what happens is it's too much of the stuff that you don't tolerate. And if you remove those things, you'll do better. So a low carb Mediterranean diet would be a better approach than to just do the straight up Mediterranean if you want to achieve metabolic health.
So with so much information out there about nutrition, how is it that you approach it with your patients?
Yeah, it's interesting because I try to keep it simple. The first thing is we talk about what to remove, right? And what we remove is sugar. So let's just stop doing that. That's literally like a drug to your body. And obviously,
Mhm.
high fructose corn syrup, which is even worse. The second thing that surprises my patients is the seed oils. Like the any oil that's made from a seed that's then broken down into oil, they have to process it with a lot of chemicals. So I tell my patients, how about using, I use the mnemonic Boca, butter, olive oil, coconut oil, avocado oil. That's more of a natural oil that was cold pressed, and those types of oils don't tend to be inflammatory. Any oil that you have to convert from a seed to a oil is highly processed and it's going to give you trouble. To the extent, and while you're transitioning, it's okay to use artificial sweeteners. However, you don't want to overdo that over time, and you want to get to a point where you use more natural sweeteners, maybe monk fruit or stevia. And there's, I'm not even sure you need to use that, but if you're going to use anything, I tend to like those two and maybe allulose. I tell my patients, let's avoid the grains. So I try to wean them away from the grains, as I mentioned a moment ago, and just in general, processed food. And I try to get them to understand that the main drivers of success is to cut back on the carbs, prioritize protein because protein gives you essential amino acids and essential fatty acids. You don't have to worry about sugar spikes. It's more bioavailable in terms of the nutrients, unlike plants. You get pretty much all of it in you. Your hunger is going to be under control. And essentially, you're eating what's essential to life. I make sure they don't fear fat because saturated fat is not associated with heart disease based on the American College of, Cardiology or the Journal of the American College of Cardiology. And I just tell them if you're not hungry, it's okay to fast. So I try to keep things fairly simple, what to remove, and if you remove those harmful things, they'll make room for the good stuff. But the main thing is prioritize protein because if you eat protein, you're going to be full and you're not going to have to worry about munching and snacking all day because you're not going to be hungry. And we're both very busy. We don't have time to be thinking about food. I only think about food because it may be time, but I tend to forget about food most days. I'm just too busy living my life. And I remember where I couldn't wait to get to my lunch because it was like something you just always thought about, but I don't even think about it. And I'll look up, it's 3 o'clock. I haven't had nothing to eat and I'm still not hungry. But I do make sure to drink plenty of water because if you are dehydrated, you may then think you're hungry. You're just thirsty.
So, from your point of view as a medical professional, who should consider the carnivore diet?
Well, I think first of all, everybody should feel comfortable that that's a safe diet to the extent we know that right now. I think carnivore is great because it's easy and you're allowed to eat until you're full. Think about that lion or tiger who's kind of fighting over that bison that they killed. They're not sitting there trying to see how big their plate size is and things like that. But you'll also notice that lion or tiger, they don't suffer from obesity. They certainly don't have diabetes, right? So there's no need to count calories and with carnivore, if you don't want to count carbs like you do on keto, you don't have to count carbs. You just eat until you're full. So and more importantly, there was an observational study done that showed that the carnivore diet was very effective, and it is observational, meaning that we do need to do randomized controlled trials. But up until this point, we found with that trial that 95% of the people who participated in it said they were satisfied with the diet and achieved really good overall health. So that's really something people should be aware of. So if you look for a carnivore trial, the one that was done at Harvard is the one I would recommend people take a look at because pretty much everybody did a good. So we now know it seems to be safe, seems to give people a lot of satisfaction, and when they measure the metabolic markers that we talked about briefly, they find that this dietary pattern improves the metabolic markers. Some people will see improvement in their cholesterol and LDL. Some people see a bump up in it, but we already know that those two metrics are not really that predictive of heart disease. Triglycerides and HDL is much more predictive. A fasting insulin level is much more predictive. And so I wouldn't worry too much about any changes there because it doesn't really predict heart disease as these other measures do. So I think it's a safe diet. And I think anybody who's looking for improvements in a few key areas, mental health. Dr. Georgia E. just released a book about mental health. And if you have mental health, anything, she's a carnivore, I'm a carnivore, that's probably the best diet. When it comes to things like neurodegenerative diseases, things like Huntington's and dementia and all that kind of stuff, this is probably one of the best diets for that type of stuff as well. Obviously, people who have, things like epilepsy, et cetera, is a great diet. And so there's some medical conditions, autoimmune diseases in particular is particularly helpful for that as well. And obviously we can talk about metabolic diseases in general, which includes blood pressure, things like diabetes, et cetera. But I think if we look at those types of diagnoses, that may be a diet to consider starting with. And then you can kind of decide, some people can add back a few things, but for some people like myself, I'm optimal if I just keep it straight carnivore.
So who shouldn't do the carnivore diet? Who would it be dangerous for?
Yeah, well, that's funny. The answer, generally speaking, is no, nobody. But I think the key is you should be caught. So if you're a person who is pregnant and you're trying to make changes, right? Some people would argue that a pregnant person should at least be thoughtful about their diet in terms of sudden changes, right? Now, do I think this diet is safe in pregnancy? 100%. I think it's one of the best diets for pregnancy. I do not believe in, you'll talk to people who are anti this type of diet. They think it's extreme. They think it's hard to maintain. I think it's easy to maintain because I'm not hungry. I don't have to, my air fryer gets that ribeye done really quickly. So I think it's easier, to be honest with you. But I just think that a person who is pregnant should at least be thoughtful, have a clinician with them like myself who understands good metabolic health and go from there. You'll hear arguments about, well, keto, carnivore is going to constipate you. A lot of that is easily mitigated. So I don't think a person who has GI issues should avoid it. Guess what? I'm doing it because I had GI issues. I had irritable bowel. So I think it's, the best diet for that, as opposed to other people who think it's not a good diet. And I also think that the fat in the diet is not harmful for your kidneys. I don't think the protein is not harmful. So my short answer, that's the long answer. The short answer is that I think it's safe for everybody.
And so on that note, the trend is vegan or plant-based. Everybody in Hollywood wants to be plant-based. All of the, certain people and the government are, talking about plant-based. Everybody thinks that's the healthiest way to eat. So who shouldn't be plant-based or
Well,
vegan?
I think we just have to tell people that they need to understand that most people become vegan for good reasons. One is, I am worried about the environment. Well, yeah, if a cow burps, yeah, about 2% of the environmental effects may come from a cow. That means that 98% come from other sources. So don't worry about the environmental part. Well, if I'm Hindu and I worship cows, it's fair game. You can not eat a cow. I have no problem with that. So, but I think most people go in because they think it's healthier, right? So the first thing they need to understand, that when it comes to the blue zones, where they kind of say it's a plant lean, well, it's not really a plant lean, because all of the places in the blue zones where people supposedly have longer longevity, they all eat some type of animal. So if you go to Okinawa, Japan, and places in fact, I had a patient this week who was from Okinawa, Japan. He said they eat pork like crazy. In fact, he said, I haven't found a pig I didn't like. So I think this misinformation from Blue Zones documentaries, et cetera, is false news. And if you really want to think about it, why is Hong Kong not one of the blue zones? If they generally rank 1 or 2 in the world for longevity every single year, but it's between Hong Kong and Japan, and they eat the equivalent of 2 steaks per person per day. So we know that that's not harmful because they live the longest. But the other parts are more. I have patients who want to do a plant-based for reasons they come up with, but then they need to be educated. So if I have a patient who's not, interested, I say, well, are you aware of the fact that you need to supplement with B12? Are you aware that vitamin D may become an issue because the best sources of vitamin D come from fatty fish, fish liver and things like that. Are you aware that vitamin A is in a form that is not active in plants, and it has to be converted to an active form, and in the animal form it's already converted. So you'd have to really understand that only a small percentage of that vitamin A in plants will convert in the first place. So now you have to eat even more of it. And in some cultures, the absorption is worse, like in people of European descent. Did you not know that if you're going to get the best source of omega-3, it comes from animal sources? I take an omega-3 supplement because I eat a lot of steak. I don't eat a lot of salmon. So, but did you know that the ALA form of omega, which is in plants, only 10 to 15% converts to the active EPA and DHA form? Oh, you can supplement with algae and things like that, but you can't get it in a sufficient form from plants. So, oh, did you know that only 2% of the iron is, bioavailable from spinach? So you got to eat a
Mhm.
whole lot of spinach in order to get enough, but it's going to be 30 to 45% if you get it from an animal source like a ribeye. So what I do is I try to get them to understand you can absolutely do it. And if you have a really good reason to be a plant-based eater, it's okay, but it's going to be more complicated. Now, you're on the south side of Chicago with me. Do you really think that my patients with limited resources are going to have the sophistication to figure all this out, know what to eat? You almost have to have a nutrition professional living with you to get it right. And that's why what's happening in New York with this, Monday and Friday only eat plants approach is ridiculous, because the nutrition in those plants are held in, they have nutrition in them, but you can't get to them because
Right.
the plants have a ton of things in them that really limit our ability to get the nutrients. So when I tell people, if you haven't heard of lectins, by the way, these lectins in plants can irritate your gut, cause a leaky gut, and inflammation, and increase your risk for autoimmune diseases. And so all that wheat and beans and peas and lentils, all of those things can be harmful. If you hadn't heard of something called the oxalate, well, oxalate will reduce your ability to absorb calcium and magnesium. And by the way, that may then increase your risk for kidney stones. So they don't know this stuff. They haven't heard this stuff. And by the way, their doctor hasn't either. So if you want to complicate your life, then eat plants. But if you have a reason that does not lend itself to something like your religion, you'll probably be better off eating from the animal kingdom. And life will be a much easier journey, and you'll get all your essential amino acids and fatty acids from animals.
Awesome. Now, it's funny to me. I mean, it makes sense, but at the same time, I find it interesting that so many people that go to the carnivore diet, like they come to the carnivore diet to lose weight, right? I mean, that's like 90% of people's original reason for coming to the carnivore diet, I
Right.
think. And then you start to realize how good you feel. So you start doing other things to make yourself healthier. And it just ends up being kind of this snowball effect of being healthier for so many people. And so, like, for me, for instance, I have started grounding, which I used to think was crappery. I've started grounding. My family got me a cold plunge thing for Christmas, and it sat in my
Hmm.
living room for 3 weeks. And I actually cried sometimes when I would look at it because I was so scared to use
Wow.
it. But we've set it up. I've been using it for 3 weeks. It feels amazing. So I've been getting up and walking my dog early in the morning as the sun comes up so I can get that natural light in my eyes, and not using my phone for the first like hour and a half or 2 hours that I'm up, except to like start my audiobook or something. I'm intentionally not checking my emails and getting on Instagram and YouTube, and I'm not doing any of those things. So I say all of that to say so many people want to be healthier and live longer. What are some other things that people can do besides something like carnivore to try to guarantee their longevity? Although I know it's not guaranteed. We all have all of our days are numbered. But what can we do to make sure we're the healthiest that we can be while we're here, and hopefully live a really long time?
Well, I think what's important is what you just said. You decided, I'm gonna do a cold plunge. I'm gonna do grounding, and I didn't even know what grounding was because I hadn't heard it until I got my master's in nutrition and functional medicine. So So my body connecting to the earth and
It
somehow
sounds
the
funky.
electrical, yeah, the electrical energy is going to somehow help me function better. But it sounds crazy until you realize that the heart, we literally had a cold blue at my clinic today. Although we were getting ready to shock a patient in the clinic. Thankfully, she kind of came to. But why are we shocking them? Because we're electrical creatures. We're just electricity helps the heart. Our hormones, all of these different things. So if we can find ways to connect with the earth, and you can argue that we should have been grounding, because I mean, we didn't have shoes and all these things in the back in the day. So for me, I came up with my nest and rope acronym to remind us, what is it that we need to focus on besides diet. So the N is about making sure we eat properly, and we would argue that reducing the carbs is the best way, whether you're doing low carb, keto, or carnivore, because you're full with keto and carnivore, you may be comfortable with fasting. Do you have to fast? Absolutely not. But I tell my patients, if you're not hungry, there's no need to eat. Exercise is extremely important. You don't have to kill yourself. I have patients exercising a couple of times a week, and for some of them, that's all they need. And because some of them are older and they need time to recover, we got to do that. Obviously, sleep and stress are important. I feel completely different on days when I get enough rest and completely different on days I don't. And I've learned to manage stress in a way that is completely different. So I always pause, ask myself, should I be stressed about that issue that came up? And most of the times I find that when I pause, I'm not going to be stressed. I also have tools to help me deal with stress, whether it's meditation or other methods. The T in the nest talks about recovering from trauma. So if you've had trauma in your life and you've never addressed it, our health system has a trauma recovery center. So ask your doctor, hey, I may have had trauma that may be affecting my ability to follow that diet. Is there any resources in my health system to help out? And then how we think, self-limiting thoughts will keep you from doing your diet. It'll keep you from being successful as a parent. It'll keep you from being successful at work. So we want to remove those self-limiting beliefs. And then I have a rope acronym that talks about the relationships for the R. I am a better person because I have a wife who's a partner. And if I didn't have a partner and someone who's adversarial, I would probably not be as well-rounded and good of a person as I am. So I'm thankful that my relationships lift me up. You want to avoid organisms and pollutants that harm you. A pollutant could be something as simple as excessive alcohol. I consider excessive carbs a pollutant. So you want to be mindful of that. I was able to heal my gut initially, or at least feel better with probiotics when I was starting my journey before I realized the diet was even better. And that's an example of organisms that can help you as opposed to harm you. And then the E focuses on life experiences that serve you. So I make sure that me and my wife's not aware yet, but I'm going to take her to see the Golden Girls for Valentine's Day. And she loves the Golden Girls as a play. And so those experiences help to make Valentine's Day special, but also to make our relationship better. And lastly, the E is for protecting our emotions. If my wife's in a good mood, I'm in a good mood. If I'm in a good mood, she's in a good mood. So we want to really be thoughtful of our emotions. Some people, I think everybody should consider getting a relationship coach, a life coach, because we need people to put things in perspective. So when we have tension, we'll be able to pause, have somebody to coach us through that tension and protect our emotions, because you can have a great day and one little thing that's negative for your emotions coming from the world or from your partner can mess it up. So I tell people, if you're going to be healthy, I definitely want you to do a carb reduction diet, but if you don't address those other things, you're probably going to still struggle. So that's why I think my life is better. My patients' lives are better. My friends and family lives are better who are doing this. And I think everybody should pause when they struggle and say, where do I have gaps with any of those areas? So that's kind of how I approach it. And so when I have patients who struggle, some people get a handout and they kill it and they're done. Other people, they get the handout, they come back and they're like, Doc, I just couldn't do it. And then you start probing and peeling that onion. Oh, you do have an issue. Oh, I didn't know you had lost 3 relatives in the last 3 months. So we give them grace and say it's
Mhm.
okay to not be successful when you're in a storm. But guess what? It's a storm. It's going to pass. And when it passes, now we can move on to help you do the things that you're going to do so you will be healthy and not have the outcome of those three relatives.
Some awesome. Thank you so much, Dr. Hampton. I think this was so educational, and hopefully we can encourage some people today to get off the carbs and the processed foods and to just get healthier so your life can be better.
Yeah, and I want to say, Serena, the person who organizes my my schedule, her name is Serena too. So shout out to Serena as I talk to Serena. That's right, because she keeps me together, and really
Awesome.
appreciate her being part of my team.
That's wonderful. Okay, thank you for joining me, and hopefully we can do it again sometime.
Absolutely, we're friends for life, so let's keep doing it.
Absolutely. And thank you so much for joining us. I'll see you next time on the Carnivore Revolution.